My name is Jeff Dash, uh, and my talk is entitled The Production of Thyroid Hormones, Molecular Biology and Pathophysiology. My background is I worked in the hospital for 25 years as a diagnostic interventional radiologist, after which I retired from radiology and opened a clinic specializing in natural thyroid and bioidentical hormones. I prescribed natural thyroid for 20 years. And during that time, I I wrote extensively about natural thyroid, and eventually uh, compiled this book, which came out in last year, and it's available on Amazon. Natural Thyroid Toolkit. Uh, when I first started prescribing, started my clinic with prescribing bioidentical hormones for menopausal women. I would call myself a reluctant thyroidologist. Why? Because I was reluctant to prescribe thyroid hormone to my patients. Instead, I thought, I'll let the primary care doctor prescribe thyroid, and I'll take care of the bioidentical hormones. So what happened was I quickly discovered that my patients were being undertreated, mistreated, inadequately treated, and I decided, if I want my patients treated properly, I have to do it myself. You know, uh, so I started prescribing natural thyroid, and this is the motivation for the book. Let's start off looking at some radionuclide scans of thyroid disorders. Part of my job in the hospital was to do thyroid imaging. Part of my job was also doing ultrasound guided biopsies of thyroid glands, thyroid nodules, and cysts. The nuclear medicine, the radioisotope that we use is iodine 125 or technetium 99M. So nuclear imaging of the thyroid is imaging of the iodine molecule and the uptake within the thyroid gland. Here on the left, we see a Graves' disease patient with an enlarged, hypertrophied, smoothly enlarged thyroid gland with increased radioactive uptake. These glands are stimulated by the Graves antibodies, the TRAB and TSI antibodies. On the right, we have normal for comparison. Another scan showing a hot nodule on the right. This patient was also hyperthyroid with suppression of the normal right and left lobe tissue. Here we have multiple hot nodules. This patient who has a toxic nodular goiter is also hyperthyroid. Labs are similar to Graves' disease patient. Here we have another toxic nodular autonomous nodule, single autonomous nodule. So both of these patients are hyperthyroid. And as a matter of fact, all three of these patients are hyperthyroid. This patient has no visible thyroid, allowing the diagnosis of thyroiditis, which is characterized by low or no radioisotope uptake. Because there's so much inflammation in the thyroid gland, it cannot take up iodine. Instead, we see salivary gland uptake, but no thyroid uptake. Ultrasound of the thyroid is also useful, showing here's the right lobe, here's the left lobe, with normal tissue, vascular bundle, and then a very large cyst with very few echoes in the back, no echogenicity in most of the cyst, indicating fluid. A different patient showing a large mass here in the right lobe with mixed echogenicity and compression of a sliver of normal thyroid tissue in front of it. Of course, large masses like this should be biopsied, and these are usually visible and easily palpable. And many of them will turn out to be malignant. I for the question of thyroid screening of the entire population comes up frequently. I don't recommend thyroid screening of the healthy population because 2/3 of women will have small thyroid nodules. And this, by screening these people, we will create a thyroid nodule epidemic of overdiagnosis. These are some of the references related to that, and you can read more about this in chapter 33 of the book. What does hypothyroidism look like? On the left, we see a typical characteristic appearance of low thyroid condition, with the head having the appearance of a overinflated beach ball, with fullness underneath the chin, puffiness around the eyes, loss of hair and eyebrows. The after thyroid hormone treatment, we see transformation into a much younger appearance, with all this puffiness around the eyes disappearing, and now we see better definition of the chin and improvement in the hair quality, a much younger appearance with the use of thyroid hormone. What are the symptoms of hypothyroidism? Chronic fatigue, constipation, weight gain are very common. Cognitive dysfunction, because the brain needs energy and can't get any. Depression. Thyroid hormone is the ultimate antidepressive. Cold intolerance, hair loss, weak, brittle nails, dry skin, muscle aches and pains. In women, irregular menstrual bleeding, which may be heavy, and infertility, because ovarian function depends on thyroid function. Cardiomyopathy, because heart muscle needs thyroid hormone to function, to give it energy. Without thyroid, the heart turns into a large bag with low ejection fraction, typical cardiomyopathy. Cholesterol tends to go up in low thyroid condition. Hoarseness. Psychiatric disorder is common in patients with low thyroid function, because of the brain has no energy. Clinical signs of hypothyroidism: low body temperature, myxedema, periorbital edema, delayed reflexes, hair loss, thinning of eyebrows, weak, brittle nails, goiter, enlarged thyroid, slow heart rate, sweating may be decreased, abdominal distension, enlargement of the tongue. Let's take a look at some images of this is a drawing of the microscopic image of the thyroid, showing the follicle, which is the basic microscopic unit of the thyroid. The thyroid gland is basically a bag of a large collection of these small bags, which are lined by thyrocyte cells. These are the cells that do all the work. They produce thyroid globulin, which is also called colloid, in the center, stored up in the center of the follicle. Here we have a typical microscopic appearance of the follicles, which are the basic units that do the work in the thyroid gland. We see the thyroid gland is made up of thousands of these small follicle working units. In Hashimoto's thyroiditis, we see on the left a normal section of thyroid with normal follicles containing colloid. On the right, we see lymphocytic infiltration, typical for Hashimoto's thyroiditis, with immune cells infiltrating, indicating autoimmune attack on the thyroid. What does thyroid hormone do? What is the function of thyroid hormone in the body? Thyroid hormone acts primarily on the mitochondria, increasing size and number and function of the mitochondria. Here's a schematic of a mitochondria showing the outer membrane and the inner membranes called cristae. On the right, we see an electron microscopic image of the mitochondria with the inner membranes where electron transport and oxidative phosphorylation takes place. Thyroid hormone stimulates mitochondrial biogenesis, increasing size and number of the mitochondria. Mitochondria, as you know, are the little energy producers. So without thyroid hormone, we have lack of energy in all of the cells of our body. Thyroid hormone gives us that energy back. We're going to stop here and take a break and continue in a minute. Thank you for your attention so far.